Sepsis is a clinical syndrome that complicates severe infection. It's characterised by an early systemic inflammatory response syndrome, or SIRS, and a later compensatory anti-inflammatory response, or CARS. The early systemic inflammatory response leads to tissue damage and often multi-organ failure. If the patient survives this early septic storm, they go on to have a compensatory anti-inflammatory response, which leads to immunosuppression and renders the patient vulnerable to secondary infections, which can prove fatal. Both the SIRS and CARS responses can be triggered by other causes of tissue damage, such as trauma, burns, and pancreatitis. The systemic inflammatory response syndrome is defined as the presence of two or more of the following: temperature, either greater than 38 degrees C or less than 36 degrees C, a white blood cell count of greater than 12 times 10 to the 9 per litre or less than 4, a tachycardia with heart rate greater than 90 a minute, a respiratory rate greater than 20, or hyperventilation with a PCO2 less than 4.3 kilopascals. If these changes are caused by either presumed or definite infection, then the patient has sepsis. If organ dysfunction is present or there is evidence of tissue hypoperfusion, either on clinical examination or with a raised serum lactate, then the syndrome is defined as severe sepsis. And if hypotension is present which does not respond to fluid resuscitation, this is defined as sepsis-induced hypotension. This Venn diagram illustrates how sepsis and SIRS overlap. Sepsis and severe sepsis are subsets of infection, but also of the SIRS response, which should be caused by non-infective causes of tissue damage, such as pancreatitis, severe trauma, and burns. The systemic inflammatory response syndrome is a cytokine-mediated pro-inflammatory response. Key biological mediators are tumour necrosis factor alpha and interleukin-1. Widespread activation of inflammatory and coagulation cascades causes 1. A systemic increase in capillary permeability, leading to loss of intravascular fluid into the interstitium, resulting in hypovolemia. When corrected, this generates tissue edema. 2. Cardiovascular instability, that is, hypotension, tachycardia, and dysrhythmia. 3. Microvascular thrombosis. And 4. Impaired mitochondrial respiration, resulting in cellular hypoxia. The end result of all these processes is multi-organ dysfunction. The molecular biology of sepsis is a monumentally complex subject, and I don't intend to do anything more than brush the surface of it. The emphasis in this tutorial series is firmly on the clinical implications of the biological carnage that sepsis causes. The cellular response to infection is generated by the endothelium, neutrophils, and monocytes. The end results of the process are capillary leak, microvascular occlusion, cardiovascular instability, and organ failure. The compensatory anti-inflammatory response syndrome is a systemic deactivation of the immune system that occurs to restore homeostasis following sepsis. It's also cytokine mediated, with interleukin-10 prominent. An excessive CARS response leaves patients vulnerable to infection, often with organisms that would not normally be pathogenic, such as Pseudomonas. The CARS response involves reduction of lymphocyte numbers by apoptosis, reduced response of monocytes to cytokine stimulation, and expression of cytokines that suppress tumour necrosis factor alpha. The CARS response is less well understood than the SIRS response, and this is a very brief introduction to it. This slide shows three possible responses to severe septic insult. The blue line shows a patient who mounts a strong pro-inflammatory response, weathers the septic storm, and recovers fairly rapidly. The black line shows a patient who mounts a poor pro-inflammatory response, perhaps due to old age or infirmity, and enters a state of reduced immune function that takes longer to resolve and may leave residual physical problems. The lower orange line shows a patient who mounts a particularly poor inflammatory response and then develops a hypoimmune state, which leads to debilitation and eventually death.